About 1/3 of people who get breast implants will develop some sort of inflammatory illness. And ironically, there's so many ways to reduce that risk if you have the right surgeon.
This is bad, but the #1 high school graduation gift for a long time in Texas for girls was breast augmentation. What I see usually with breast implant problems like breast implant illness and capsular contracture and all these other things, once it develops, it's a very chronic inflammatory process.
Dr. Robert Whitfield is America's breast implant illness expert. He's a world-renowned holistic plastic surgeon who joins the show to tell you exactly the things you need to be doing to prevent breast implant illness. And on this episode, he answers so many questions as to why breast implants go wrong, how do we prevent breast implant illness, can you go in the sauna with breast implants, find out the full transparent information to making sure you're in the best health on this episode of Heal Thyself. All right, Doc, thank you for joining the show. Very excited to talk about all of the things integratively you do when it comes to surgery. There's a lot of women we're getting breast implants, and some men, right? And I really want to talk about this because when I was doing the research years ago when I did a show on this, it was millions of women per year in America get breast implants. But the take that you're bringing forward is a more holistic model, looking at how they fit, how they look, how they are they healthy for the long-term success of the implant? How big of a role does overall health work when it comes to breast implants?
Well, first, thank you for having me on. I really appreciate it. I know you have a great following and your audience will appreciate what we're going to talk about. So for breast implants in the United States, it's a little over 300,000 get placed annually, but worldwide about 2.2 million get placed annually. And I'll just give the audience a range. So what I see usually with the breast implant problems like breast implant illness and capsular contracture and all these other things that come about, it can take a year or two, or it can take 10 to 15 to 20 years for it to develop. Once it develops, it's a very chronic inflammatory process. So we recently published a paper with over 600 consecutive PCR tests. Everybody remembers from the pandemic an antigen test versus a PCR test, and how if you had the PCR test, it was more accurate because it looks for DNA fragments. So we have over 600 samples of patient scar capsules tested for bacteria, fungus, and mycobacteria. And the predominant finding is bacterial contamination in almost 30%. It's not fungus, so please stop writing things on the internet about mold and all the things on TMZ and shit like that. It's bacteria, and it's predominantly two types: Cutibacterium acnes, which is found in super high concentrations on our face, neck, chest, and shoulder skin. And like I said, it's Cutibacterium acnes. That's right. It comes from acne. It's found in acne. And then the other is Staph epidermidis, which is a commonly found bacteria on our skin. And these and another bacteria, Pseudomonas, all produce something called oxylipins. And oxylipin tenhome is a substance created by the interaction of the bacteria with the breast tissue, and specifically in the breast tissue, something called oleic acid, which is a fatty acid. So that interaction creates oxylipin tenhome, which then stimulates the patient's immune system. And that's how they get more symptoms like fatigue, dry eyes, things of that nature.
It's an inflammatory process that can take 10 to 15 years before.
Yeah, depending on the interviews. I think from one of your shows, you mentioned you have to inventory your symptoms and when they started after you had an implant placement, whether it's for cancer or cosmetics. I took care of mostly cancer patients for 20 years. So I was obviously seeing them on a very, very specific schedule for surveillance, and then they have more problems with the number of surgeries they have and therapies. So it's a very different situation. But I didn't treat my cosmetic patients differently, so I saw them just as frequently. I think, when we are looking at when things develop, sometimes it's very quickly, and then for whatever reason, there's a big gap. Maybe there's a equilibrium is reached, and then they are not symptomatic, and then something happens and they become symptomatic. Maybe there is a different environmental exposure. So we look at a lot of that through our process called the SHARP method, and that's what the book's about. It's looking at your genetic predisposition to be able to detox environmental toxins and mycotoxins and heavy metals, then what is your exposure? Because everybody gets exposed over time. It doesn't really matter. Nobody, ate organic their entire life probably. Certainly, I'm 55. I didn't do that. So plenty of glyphosates have been introduced into my system. I drank out of a plastic water bottle like everybody else has. So phthalates are part of that equation. And then I grew up in a place with really bad groundwater. So arsenic was found, in my system.
Yeah.
So all those things get looked at, and then those all obviously affect your gut microbiome. And if your gut microbiome's off, then everything gets thrown off. Your endocrine system, your brain, everything will be off. And then, we also have begun looking more critically at what triggers you with food sensitivities, how the hormones are affected, and then metabolomics through blood spot testing is certainly the next thing that we're really focused on.
Is there any research at all on breast implant success or failure, and any other the things that you said, like environmental exposures, phthalate burden, gut health, or are we not even there yet?
So we have the most data on that in the world. And I think everybody has to understand, for you to study something, you have to get approval from what's called an institutional review board. And I've been private practice. So one, it's a little bit of a, task to get that done. But you have to have acquisition of the data. And as far as I know, we're the only practice in the world that looks this closely at this problem with all of those things I just mentioned.
Fantastic. Pioneering, then. That's the important part, right? Because we need that information.
Right.
So theoretically, then, we can maybe assume that there's groups of people getting breast implants, never tested for environmental, most likely, hormonal, gut health, at least functionally integratively, and then that's predisposing them towards immune reactions that would be causing some sort of breast implant illness.
Yeah, I look at it, there's two real patient populations. We have a younger group that after, say, 18 to 25, something like that. And then the second peak would be the 30s, mid 30s. And that represents people, from an early time who would have no concept typically of what we're talking about.
Yeah.
And if you listen to my patients' stories, many of them may have been bullied as a young person for a lack of breast development, or they just imprinted versus seeing something in a book or in a magazine or on a television show. I've had people tell me Baywatch was the inspiration behind them getting implants, Barbie, seeing people in the peer group, different moms, and it was just acceptable. So, whether it was, and this is bad, but the number one high school graduation gift for a long time in Texas for girls was breast augmentation from high school. So that, and then the other facets would be, if you take an 18-year-old mind and try to explain the risks and benefits of implant placement to them, I challenge anybody in my position to have that discussion in the way that I had it with a cancer patient and trying to explain the risks and benefits. So I didn't see a lot of young patients because of my work in cancer reconstruction, but I find most of the patients are dissatisfied or unhappy with the augmentation had either too large of a device placed, or they tell me that they didn't understand all the risks and benefits clearly. And breast implant illness is not an official diagnosis for everybody listening. It's, to me, a chronic inflammatory process of which the breast implant is playing a part. And that's why we developed our program, Sharp, because if you just explant and you don't understand any of these other factors, you may just remain in the same chronic inflammatory situation that you showed up with. So we're very strict now. I actually don't take care of patients who won't participate in the program. And the thing that's not mentioned in the discussion so far is their mindset. So a lot of people have and should get some type of work on themselves before they ever show up, because mindset's a big problem with this procedure, because you're now taking everything down and you're going to relive all the trauma or the reason why you got this from a body image standpoint.
And I want to go into the mindset and the emotional connection to it, because I know that it's very important. But before we went on air, you had mentioned a certain percentage of women who get these surgeries, and the percentage that the tissue or the capsule is causing these issues.
Mhm.
What was that percentage?
So in our study, it's 29%, and that's in over 600 consecutive tests. But now we've done thousands. So it's going to vary when you check the sample size. So I always tell people a simple rule of thumb is about a third of the time you're going to get a bacterial contaminant. And so everybody listening, there's three ways to get this. There's somebody hands the surgeon a contaminated implant. So they've opened it and somehow contaminated it. They give it to the surgeon, they put it in, but it's contaminated. The second would be they hand it to the surgeon and somehow the surgeon contaminates it on placement. So they rub the skin or do something else. The third, but by far the most common way this happens, is the implant's in place and the person who has the implant gets an infection. So that could be a urinary tract infection, a respiratory infection. They could get a skin infection from a cut. I often will use the story of cardiac surgery. So I'm old enough to remember mechanical heart valves, the ones that were made out of metal. And you would have to place those patients on antibiotics to get different types of procedures like a colonoscopy or a teeth cleaning. Because if they, for some reason, stirred up something into that patient's bloodstream, they could contaminate the bloodstream with the bacteria, and that would adhere to the valve and create what's called endocarditis, and that could be fatal in those patients. I imagine most people who have implants don't know that they should be taking steps to prepare themselves, because a lot of people don't want to take antibiotics. Understandably, they don't want to upset their gut microbiome, but you're trying to protect a device.
Yeah.
So a device is a foreign body. It has no blood supply, so it cannot clear bacteria. So no matter how many nanokinases you take, antibiotics you take, you're typically not going to clear something. You could suppress it, but you will not clear it. That's different. So when we do the operation, we try to take all the scar capsule and the implant out intact, because we don't want to, if it has cancer around it, spill that into the pocket. If it's contaminated with bacterial biofilm, I don't want to spread it. And many of my patients have ruptured devices or devices that are degrading. So the shell's degrading, it's leaching things out into their system. So all of these are, obviously the downsides of a device. A device is not made for a lifetime. And so for cancer patients and cosmetic patients, at year 8 after placement, we would always discuss with them, hey, this changes. A rupture rate increases about 0.5% per year after year 8. So we'd always be talking to them about this. It's not that you have to exchange everybody or do something different, but you just have to have those conversations.
And it's funny because I've known women who've had implants and they've had them for many years.
Yes.
And is that more often than not that people aren't coming back to get new implants to come in, but they just have them for 10, 15, even 20 years?
Do you like classic cars?
Somewhat.
Right? Do you drive one?
No.
Yeah, they're not safe. So a device placed in 1980, I would say, is not very safe.
Yeah.
So I always look and have the same discussions. Like, you're doing all these things to have a non-toxic lifestyle and lead a healthy lifestyle, but you have a device that's 20 plus years old or 10 plus years old. That doesn't make a lot of sense. So there's a lot of struggle when people come in and trying to reconcile that. They're like, I have this thing and I don't want to have this thing anymore. And, we try to help them, give them a natural holistic transformation with their own fat. So I do a lot of fat transfers. And for everybody listening, fat transfers work extremely well. The closer you are to 20, everything works better. The closer you are to 80, things work less better, obviously. So they work very well. It's just moving fat from one place to another. So for somebody who just wants a cup size change and a natural enhancement, that's an alternative. And so we would explain that to patients. And then for anybody who needs an explant, depending on a number of factors, and we look at toxicity. If someone's got just a terrible toxicity report, I'm going to tell them to wait to have a fat transfer, because we want to help them explant and then go through a pretty lengthy detox process to put them in a better position so that they can have more in terms of a successful outcome and easier recovery.
Today I'm going to talk to you about something that has been a game changer for me. That's Might Appear from Timeline. I just did a story before this show and I featured it just to show what my morning routine is. It's something that I've been taking every morning for a while now. And urolithinate is a really, really powerful postbiotic. And you can't just get it from your diet. It helps improve your mitochondrial function. But unfortunately, as we get older, those little powerhouses don't work as efficiently. And by older, I mean starting at the age of 30. So this can leave you feeling more tired, more weak, and even less mobile. But that's where MitoPure comes in. It's the first product to offer a precise dose of urolithin A. And after just 2 months of taking 2 soft gels a day, you could start seeing improvements, right? It's not just a spike up peak and you're like, wow, I have all this energy. It's a slow over time, long-term energy, which is what you want, right? More muscle strength and endurance, as seen in their double-blind studies that they've done. And after 4 months, you might notice that you're actually recovering faster after workouts, experiencing less of that inflammation, just feeling more resilient overall. Now for me, that's a big part of my health routine. I started using MitoPure because I wanted to maintain my strength and vitality, not just now, but for years to come. And one thing I love most about MitoPure is that it's actually backed by science. A lot of these products are out there and they're just theoretical, but it's really important that this is a science-based product. It's the #1 doctor recommended urolithinate supplement. It's NSF and Clean Label Project certified. That means you're getting a product that is thoroughly tested for purity and safety. Plus, Timeline makes it easy to fit MitoPure into your lifestyle, however you want to do it. They actually have a berry powder. It's perfect for mixing in the morning if you do smoothies or yogurt. The soft gels are the ones that I take, especially if you're on the go. I tried both and I love the flexibility, especially on what my day looks like. But right now, Timeline is offering you, the Heal Thyself listener, 10% off of your first order. Go to timeline.com/DRG. Use the promo code DRG. That is timeline.com/DRG. Get yourself some proper mitochondrial recovery. Today, I want to chat about something that's been a game changer. It's been in my pantry for 4 years now, maybe even 5 years. It's Active Skin Repair. I just gave some to my friend who has 2 daughters that run around and cut their knees all the time, cut their arms all the time. Active Skin Repair is fantastic. I've seen a lot of skin products out there come and go. This one is different. It's been around for a long time, and it's all about working with your body's natural healing processes. And the thing with this product, it uses a molecule that is inherent in white blood cells called hypochlorous acid. And what I love about Active Skin Repair is it's versatile. Whether you're a sunburn or a nasty cut or even dealing with something like eczema or rosacea, this stuff is wonderful. It's got you covered. It's non-toxic, one of the most important things for me. It's for all skin types. And for someone who's always on the go, I actually appreciate having a simple solution for all types of skin issues. No more cluttered medicine cabinets because you have something that's going to treat the trauma in the wound and help it heal. But don't take my word for it. Go check it out. Over 500,000 people have given Active Skin Repair a try. And we're talking about thousands of 5-star ratings. Go to activeskinrepair.com to learn more and give it a try for yourself. Use the code DRG at checkout and you're going to get 20% off of your order. That is activeskinrepair.com and use the code DRG for 20%. When it comes to overall toxic burden, have you ever identified any of the toxins, or is it just the whole slew of them, like heavy metals, you mentioned glyphosate, or is there any that okay, wow, this person has really high mercury and lead, and that tends to just be a real issue when I'm doing a fat transfer?
The most frequently thing we see are toxins from mold.
Mold.
Yeah, I think whether it's your home or your work environment, the most common thing we will see are mycotoxins. And then, of course, without, we would be remiss without mentioning things like coffee that has mold or grains that have mold, wine has mold. So there's all these things that get introduced all the time, and then they will affect, everybody who's listening has to understand, before your liver shows abnormalities on the typical standardized blood tests, you have to lose a tremendous amount of function. What we're talking about is a very specific, narrow range, and we see the toxicity, and then your body's struggling to get rid of it. So you have to, one, be able to bind it, get it out, and eliminate it. So we'll talk about, elimination. Your GI tract has to work. You can't be constipated. You have to eliminate waste. If that's not working, which a lot of my patients have difficulty with that, there's no chance that you make all these changes and magically they're going to get better. So if they're genetically having trouble with detoxing and their toxic burden keeps rising, then they're further challenged. So we try to get everybody doing the same things. And I know there's a lot of people worried about bio-individuality, which of course we want to help treat people as individual as possible, but some basic things have to happen. genetically, you need to support immunity. So we make sure everybody's got supplements to help them. And for everybody listening, I get a lot of feedback about supplements, and there's too many to take many times. They get pill fatigue, they can't swallow them. So we converted the core ones to liquid. So they're liposomal. So you're absorbing them in the oral cavity, in your mouth. So that's a way to start helping improve immunity very, very rapidly. The caveat being this glutathione. If you have a high toxic burden and you start giving people oral liposomal glutathione, it'll taste bad. So you just start them off slowly and let them build up. And then, taking things out of the diet that are not, because you're not told this, you're not taught this. Certainly was never taught in medical school to me. Things like gluten and things like dairy and seed oils can all be pro-inflammatory and worse in some patients than others. I have non-celiac gluten sensitivities, so I haven't eaten gluten in a very long time. I don't methylate well. A lot of people have heard about MTHFR, but COMT is another gene that's very important in my patients for detoxification and estrogen metabolism. So the worst scenario is somebody who detoxes poorly, has a high toxic burden, doesn't metabolize estrogen properly, poor gut microbiome, triggered with a lot of foods, tons of hormonal imbalance, and that just sounds bad. All those things at one time happen.
Yeah, yeah. And how often we see that, right? Like there's a lot of people who are in that exact boat for A or B reason, right? We're not really taught in medicine, as you said, to do these testings, see what their toxic burden is, and really even start talking about the gut, at least generally speaking. That's just not taught. But it's fantastic to hear that like there's people coming in for surgery and it's being integrated in. I mean, I've met a lot of surgeons. I don't know anyone who's talking about gut and environmental toxins. Is this something that's a rising tide here, or it's or you might be the only
well, we'll
one?
see with the book if how many little haters I have come out for that. But the point is, everybody who trained in my discipline in plastic surgery, who was at a big center that took care of critically ill patients, like if you've taken care of critically ill patients, you understand nutrition. I was taught, and I had extremely talented mentors who were very rigid about being a good doctor and understanding all these aspects of critical care in order to take care of their patients. Because if you weren't good at it, they would not let you take care of their patients. So, and recently, one of my last famous mentors passed away, and I all of my mentors are great at, and you don't appreciate them in the moment because they're being pretty hard on you. Training's not easy, and I trained at a time where it was before work hours restrictions and all these things. But they were supremely talented people, and they wanted you to be a very good doctor and understand all these elements. So none of the things that I mentioned outside of functional genomics are anything out of the norm. As we got better testing, I think you have to adapt to, and you should adapt to as a practitioner, what's going to be best for the patients. If there's a better test to help, I want to know about it. I want to provide it. If it's going to help a patient recover faster, because every patient who comes to see me wants the least amount of bruising, swelling, discomfort, downtime, so they can participate in their life, take care of their kids, and be present, for their family. That's what everybody wants. So all we're trying to do is facilitate that. And I don't want to work with patients who don't want to take those steps before, because I know on the back end, it's much easier if they have.
Yeah, well, it makes sense, right? And hopefully, that's where it starts moving across the board. But I assume that it's going to be a little bit slow, as you probably know. But you mentioned mindset, and that really, I love talking about this stuff. I love talking about the effect of our nervous system and our overall health and inflammation. How big of a role is that mindset piece when someone comes to you for recovery and just for long-term, success?
Well, I have lots of examples where you can just tell people are supremely uncomfortable, meaning they may have pain, and the pain may be somatic. It may, be, more emotional. It just depends. Like if you see somebody sitting in front of you, basically can't sit still and they're crawling out of their own skin, that's not a good situation. And my team is very, very good about identifying patients who clearly are in a bad spot. And many times, as you know, if you give those patients maybe a lymphatic treatment or something to get them in a more parasympathetic state, they'll start to feel better. I'm a big fan of hyperbaric oxygen. I think it's always great to give people oxygen because they have a lot of tension that creates more hypoxia in their muscles and they're just tight and everything just feels like better when you have more oxygen.
Yeah.
So I try to get people understanding that when you are paying attention to your air quality, the fluid you put in the system, and the food quality, and then of course supplementation. These other factors like getting your lymphatic system working more efficiently, using things like red light therapy to lower inflammation and improve detox. And then I like hyperbaric. We have to mention a little bit about sauna. I try to have people stop using sauna prior to explant because I've had a couple different patients who really just kind of like we talked about before. If someone's got a shell of an implant that's breaking down or a rupture or something like that, nobody has the data to tell you that's a good thing. But I can tell you symptomatically when patients talk to me, it's a bad thing. So I'd rather them just calm that aspect down, have the surgery if they're going to do that in the given time frame, and then at about 90 days after, with our detox team, which we have a whole group devoted to caring for patients that way, they'll reinstitute it, and they may use a binder in addition, some things that are more strategic.
You bring up sauna, and I actually got a lot of questions on this online. I don't know. I didn't know how to answer, but will an IR sauna affect a breast implant just in general, like even a brand new one? Will it heat it up too much?
Yeah, I love this. So nobody knows that answer, and all the trolls come out, so you might have some rollout. So I would say nobody knows. I have probably more anecdotal evidence just from patient stories telling me, and then not an IR sauna story, but one of my most prominent clients, Lauren Bostic, was using a barrel sauna that got up to over 212 degrees Fahrenheit. And her shell was degrading. She had the worst toxicity burden report I'd ever seen with heavy metals. So on a whole, I don't see bad heavy metal reports. And it's, I don't know if it's because it doesn't get hot enough in an IR sauna, but when people start telling me they don't feel well after sauna, so the public service announcement is if you do a sauna session and you feel really bad, that's not good. That doesn't mean do more. You're basically giving yourself what's called a Herxheimer reaction because your detox ability has been surpassed by your toxic burden and then that session maybe. So it's probably in your best interest to just pause and then, ask yourself like, should I really be doing that much to myself? As I find my female patients are much tougher than male patients. Like they'll rigorously do things to get better. Like if you give them a plan, they're going to try to execute the plan. They'll be all in, but you have to make sure you're protecting them from themselves.
Yeah, I see that even not in obviously surgery, but just compliancy when I was in practice. The patients they'll go right to it, all the supplements, ask questions, emails, and I'm like, these are the best, right? Like that they're gonna follow through. Yeah, I mean, it's just that's a great, and thank you for answering that because I couldn't find anything on it really, and I didn't know how to answer whether or not someone should be in a sauna.
There is no answer that exists
answer.
Because and then I got in a lot of trouble for saying it, but I have all the reports on those patients who've exhibited that, and then the barrel sauna, I can tell you for sure can create a problem, but just like we said, like. The device is not a lifetime device. If the device is degrading and the chemicals or heavy metals in the shell of the device are being leached out so the proper word is leaching for everybody listening, not melting, which I said on a show, I got tons of trouble. It's leaching. And there's plenty think of like the hot water bottle in the car. The phthalates are going to come out of the water bottle shell into the water. You're going to drink it, and that's going to be an endocrine disruptor. Same concept.
Same concept. In this sharp method, what is the strategic? What does it embody, the sharp method, so people can know what to expect if they're going to get any sort of surgeries? They know they're going to get your book. What can we expect?
I think everybody, to the best of their ability, should understand their genetics. I think there's been a lot of just shade thrown on genetics. It's something's going to happen if someone checks your DNA or something odd. But the biggest advances I think we'll see coming are going to come from gene therapy once they identify more and more opportunities to help take care of patients with chronic disease. First of all, you should start by just modifying your air quality, fluid quality, and food quality. Those are the things you can do right now. And there's no pill shot drug that's going to affect that better than those behavioral changes. But then understanding your genetics, we use Envision Labs right now because they both provide my patients really complete detailed reports on their genetics, but they also include drug metabolism genetics because many of my patients are frightened of anesthesia and using any of the medicines evolved around that process. So nobody has ever woken up during anesthesia, and nobody ever will. I have a great group that really is devoted to the patient experience and creating the best environment for them. So I'm very fortunate. I've had the same group take care of thousands of my patients, and they work really closely with us to provide additional nerve blocks with local anesthesia before someone ever goes back to surgery. Mm-hmm. And then I do more in the operation. So we're really trying to increase the ability of that patient to not need any narcotic after surgery, because we don't want you to take a bunch of medicine either.
Mm-hmm, mm-hmm. Of course not, right? Like, and
no.
A lot of people go home with it, and it's adverse reactions, and it's a whole thing.
Right. The more things you take, the more things can happen. So we have everything available, and we tailor it based on the patient needs. And then, so genetics, obviously, that's been my main curiosity, because I'm old enough, to have seen the genome project mm-hmm. actually come to fruition, which was completely amazing. Mm-hmm. Everything else really hinges on what we were discussing with toxicity burden. So you can genetically detox so much, but then your environmental exposures really dictate the rest. Yep. Because that's going to affect everything. And principally, we're talking about your gut microbiome, because that's how everything gets into your body, or it's, topically, not as much, and really concentrating on food as medicine rather than any other direct mechanism. I concentrate on that, and I talk about that, and I want you to increase your protein intake and the quality of the fats, and really cut out, sugars and processed things. Like, none of that belongs in your body. Your body's a high performance machine.
Yeah. Yeah. And we want to make sure we're running it on a top level. And I really appreciate that integrative approach, man. Like I said, I worked with surgeons before when I was in oncology, and I was integratively doing my thing, and some were kind of open a little bit, but it's really great to hear that there's people out there testing for these things and knowing the implications long term. Is there anything that really we haven't covered that really you want to speak on?
Well, going back to that point, so I think all the time we have patients come to us that we're told, or I get sent a message on social media or on one of the platforms that they had an implant removal, but then after the surgery, they were told that the capsule was not removed because it was too dangerous. So let's try to dispel this danger thing. So if you go to see a surgeon and have an explant, which is your right, your prerogative, it's your body, you can do that. If they are uncomfortable or give you the explanation that it's too dangerous to remove the scar capsule because you're going to injure someone's lung, I would suggest that you just get up and leave, because it is not, quote unquote, a dangerous operation for somebody who's done reconstructive surgery at a fairly, good level. So breast reconstruction or chest wall reconstruction for cancer, depending on where you trained. So it's not a dangerous operation. And just if you follow the logic of what we've been talking about, if you remove a device but leave the bacterial contaminant behind, you're going to keep the same feedback loop to the immune system. So chronic inflammation will not go away. And I get patients that I have to reoperate on because those capsules were left in. Mm-hmm. And they're still symptomatic. Now that's, playing a stupid game, honestly, from a surgical standpoint. Because at one point or another, you're going to leave a breast cancer in place, you're going to leave one of these breast implant associated cancers in place, or you're just going to leave infection in place, basically. And so you're going to have the same feedback loop and give people an operation that doesn't solve a problem.
Mm-hmm.
So it's not a dangerous thing. And I think now patients, just like your patients when you were working, told you they do their own research. Okay. So that's a challenging thing when the patient has to, not only advocate for themselves, but they have to do all of their own work to determine what is the best course of action.
Yeah.
That's problematic. So we made the paper we published about bacteria and implants available to the entire world. It's open access. It's available on all of our platforms. So you can go to YouTube and read the paper. And I'll do videos regarding what is the best available literature on the topic. Like we just talked about bacterial biofilm. There's this substance called oxylipin-10-home. The scientist is Dr. Mithun Sina out of Indiana University Medical Center. And he has by far shed the most light on this topic in terms of a cause and effect. So bacterial biofilm causes an interaction with breast tissue, which creates this oxylipin-10-home. And then that further stimulates your immune system to cause the symptomology. So the book, Sharp, really highlights how to address surgery at any level for recovery. And you can have this yourself, and if the folks that you're working with don't have access to or can't help, then obviously you can contact us online and we'll help facilitate that. But more and more, this should become let's say the minimum. I think the bar is so low right now, this should become like where the bar starts instead of this seems like some really far-fetched program.
Yeah, I agree. I love that. How do people access that book?
Yeah, so Sharp is on Amazon. You can get it off of there, and you can go to our store, Dr. Rob's Solutions. We have it there as well. And if there's questions or comments, please send them to us. If you're a patient who has breast implants and is concerned about breast implant illness, either because you have it or you know someone who may have it, then go to our YouTube channel. And we've done a series of videos that are all really educational based. Plus we have many patient stories, and I have a podcast just devoted to this topic.
I love that. Everybody, if you have breast implants, thinking about it, someone you love has breast implants, you know where to go. Go to that YouTube, watch those videos, get the Sharp method. I'm going to say it. Strategic, Holistic, Accelerated Recovery Program. Sharp, go get the book. Thank you so much, Doc, for coming on the show, shedding light, doing what you're doing, man. This is true holistic surgery at its finest, and I appreciate that very much.
Thank you very much for having me.